So today we're talking about advanced clinical practice, and it's a piece of work that Health Education England is doing across the system with NHSI, with NHSE, really trying to look at how we create the right impact for the public, right impact for employers and the right impact for the system. So we're going to cover several topics. We're going to look at what is advanced practice, and we're going to talk about why advanced practice is a real key component of workforce transformation. And then we'll talk about some next steps. So this workforce is dealing with a high level of complexity. People with multimorbidity needing to deliver their work in a way within a team with a high level of autonomy, decision making within the team, dealing with uncertainty and ambiguity, and often managing a high level of risk. So it's a really complex role, people working really to the top of their licence. But the role that we have in all of this is understanding how we train that workforce and how we embed that workforce into our services. So advanced clinical practice is really a key part of workforce transformation. It's really thinking through how do we use our talents of our workforce to the best benefits of our population. Really trying to match that talent so that we retain the talent in our system. And we've got the need to build really broad, versatile and flexible members of our workforce, but with really good broad skills but very deep, good specialist skills too, that will enable us to meet the needs of an increasingly complex population. We also need to make sure that we're transforming the workforce and really supporting the workforce to operate in the most person-centred way it possibly can, putting prevention, supported self-management, shared decision-making absolutely at the heart of how we operate. We also need to think about how we liberate those professions. We've got highly intelligent and skilled people that we need to liberate so that they can actually use their full talents to serve the population. When you think about how we look at primary care pathways, how we might think about putting musculoskeletal practitioners, for example, at the front end of a pathway in primary care as first point of contact practitioners, we get to a point where we can completely change the onwards pathway for people by putting supported self-management at the front of a pathway and preventing people getting into unnecessary secondary care pathways, enabling people to stay at work, stay at home and to optimise their own self-management in the community where that is the right thing to do. So a huge opportunity for intelligent workforce transformation. So advanced clinical practitioners, as highly experienced clinicians, enables us to really rethink how modern teams can operate. It enables us to think about how we redistribute workload around a team. It enables us to think about how can we not spend money on transient workforce, on temporary workforce, and actually spend that money on investing in the people that we have in our teams. How can we really think about developing 24/7 decision-making capability, education and supervision of our teams across the 24-hour-a-day timetable? How can we really think about upskilling our team members so that we are really utilising the opportunity of the advanced practice training to upskill people in thinking about mental health as much as physical health, thinking about person-centred approaches to care? How can we really think about helping people flex and morph across traditional boundaries, professional boundaries, and really think about offering care that that population requires at that time and develop that workforce? This helps us build stronger teams, it helps us keep resilient, and it helps us really think through how we can also achieve the other added benefits of having a highly experienced workforce in the team, of looking to developing research and quality improvement capability across pathways, co-producing improvement with patients and people from the public, and really think about how we create self-actualising careers for people, not just jobs, but careers that keeps our intelligent workforce engaged in their work, enjoying their work and offering their best service to a population. So onwards from here, we have created a number of videos for you to give you the chance to really think through the opportunities advanced clinical practice can offer you. It's not the solution to every problem, but sometimes really think through how you could utilise this opportunity to the benefit of your population. I hope you enjoy them.